You know, when a huge coastal storm slams into a city, the headlines are always about the wind speed, the flooding. But the real story, the one that impacts people for months, sometimes even years after the fact, is this hidden health crisis that kicks off long after the skies clear. And to really get the true scale of this, we've got to start with the numbers. Just look at this. $19 billion. That's the estimated economic loss that New York City alone suffered from Superstorm Sandy. It's a staggering number. But behind that financial cost, there's an even bigger human cost, a whole cascade of health problems that, honestly, we're only just now starting to fully grasp.
So why is this all becoming such a massive issue right now? Well, it's because we're facing what you could call the storm before the storm. It's this perfect convergence of two really powerful trends happening at the same time.
First off, just think about where we're all choosing to live. In a 40-year span, the population in America's coastal areas jumped by nearly 40%. That's millions upon millions more people, more homes, more hospitals, more everything, all packed into the most vulnerable places. And second, the storms themselves are changing. The way the researchers phrase this is so important. They're not just saying storms are getting a little worse, they're pointing to a triple threat. They're expected to be more intense, hit more frequently, and last longer. And this is all being driven by climate change and rising sea levels. Okay, so what happens when this rising tide of risk finally hits the coast? As the storm makes landfall, the immediate dangers are pretty much what you'd imagine. But when you look at the data, a really chilling pattern starts to emerge. This data from Superstorm Sandy in New York City just lays it out in stark terms. An incredible 79% of the deaths were from drowning. It wasn't falling trees or power lines that was the biggest killer. It was the raw, overwhelming power of the storm surge. And here's the thing. That risk is not the same for everyone. Look at this. Nearly half of the people who died in New York were 65 years old or older. This points to a really crucial theme we're going to see over and over again. It's the most vulnerable people in our communities who always bear the heaviest burden. But here, this is where the story really gets interesting. The initial hit from the storm, that's just the first domino to fall. What comes next is this chain reaction of secondary hazards, all the dangers that linger for weeks and even months. And this gets right to the heart of the problem. A lot of the time, the greatest danger isn't the wind or the rain. It's the collapse of these incredibly complex, interconnected systems that we totally take for granted every single day. You can see that domino effect right here. It all starts with the flooding. That damages critical infrastructure, which then leads to long, drawn-out power outages. And from that one failure, losing power, a whole new wave of silent, hidden health risks is unleashed. I mean, really think about what a blackout means. It's not just sitting in the dark, right? It's people using generators inside and getting carbon monoxide poisoning. It's refrigerators going out, so food and water go bad. It's people who need electric medical devices suddenly being cut off. It's this whole cascade of problems that are so easy to forget about.
And this isn't just some theory. Get this. During the 2003 blackout in New York City, which wasn't even caused by a storm, the mortality rate jumped by 28%. That's about 90 extra deaths, just because the power went out. It's proof that a utility failure all by itself is a major public health crisis.
And this strain, it goes way beyond the power grid. It pushes our entire healthcare network right to the breaking point, and it creates these impossible choices for doctors, nurses, and patients. I mean, just look at this dilemma. Put yourself in the shoes of a hospital administrator for a second. What do? If you evacuate, you're putting frail patients at risk during transport, and you might just overwhelm the hospitals you're going to. But if you shelter in place, you risk losing power to life support machines and completely running out of supplies. There are just no good answers. And for the hundreds of thousands of people forced to leave their homes, the health consequences are just huge. People with chronic conditions like cancer or diabetes miss their treatments. Infectious diseases can spread like wildfire in crowded shelters. And just basic care, like getting a prescription filled or going to a prenatal checkup, becomes an absolute nightmare. So beyond the physical dangers, beyond the disrupted medical care, there is another, much deeper impact. We're talking about the invisible scars that these disasters leave on our minds. And this highlights a really profound truth. We can rebuild a house in a few months, but healing the mind can take years. The psychological trauma of losing your home, your sense of security, your community, That is a massive public health issue that we often just sweep under the rug.
And this trauma is incredibly persistent. Just look at this timeline. We're not talking about a few bad weeks. Research shows that even 5 years after hurricane, people in vulnerable groups can still be suffering from post-traumatic stress disorder. The storm is long gone, but the trauma sticks around.
And just like the physical risks, this mental health burden isn't shared equally. The risk of long-term problems is way higher for women, for people who already had a psychiatric condition, and for those who don't have a strong social support system or who lose everything they own. It's really a crisis within a crisis.
So, what do we do about all this? Well, the key is to stop thinking about risk as something that's spread out evenly. We need to start identifying and mapping out where the real vulnerability is so we can prepare a whole lot better.
This is the core idea. Vulnerability isn't just about living in a flood zone. It's about where that physical hazard crosses over with a community's social and economic resources. Do people have the money to evacuate? Do they speak the language that the emergency warnings are in? That's what truly determines someone's risk.
This table just puts it all together so clearly. It's like a roadmap of risk. Look how it connects a specific hazard, like a power outage, to a health impact, like carbon monoxide poisoning. And then it identifies the most vulnerable group, in this case, non-English speakers, who might not understand the warnings about using generators indoors. This is how we can start being proactive instead of just reacting. And ultimately, when you boil it all down, the research makes one connection that is just undeniable. As this quote says, poverty is one of the single biggest things that amplifies risk. The neighborhoods with fewer resources are the ones that are going to suffer the most and take the longest to get back on their feet. So this leaves all of us with a really critical question to think about. It's not just about what happens when the storm hits. It's about the strength of our infrastructure, our healthcare, our social safety nets. Because as these storms get stronger, and they will, the real question we have to ask is, how resilient is your community?